So this is a simulated patient task assessing information gathering, communication with patient, communication with colleagues, patient safety and applied clinical knowledge. You are the registrar on call today. A&E called you to review Emma Johnston, a 22-year-old patient who presented with acute urine retention. Her bladder scan showed 450 cc in her bladder. While attempting catheterization, A&E nurse noticed an inflamed genital lesion with blisters, which is highly suggestive of genital herpes. You are required to take the history, plan for the management, and address the patient concern. So let's agree that the most common presentation of genital herpes infection is urine retention. That's why the patient can feel severe pain while she passes urine. So she's afraid from passing urine and hurting herself from burning sensation and severe pain from down below. And sometimes the virus itself can affect the nerves and affect the parasympathetic nerve. So sometimes there may be neurogenic affection of the bladder innervation. So it's just a urine retention due secondary to neurogenic problem related to the viral infection. Okay, so first of all, we need to know what is the virus causing this infection. It's called herpes simplex virus, and we have two types of this virus. We have type 1 and type 2. Type 1 mainly affecting the upper half of the body, and type 2 mostly affecting the lower half of the body, but sometimes it can be either ways. So type 1 most commonly comes in the upper half, but it can come in the lower half, and also type 2 mostly in the lower half and can come or affect the upper half as well. So when we go to see the patient, first of all, you introduce yourself by name and role, then ask her about what happened, since how long she feels that she is not able to pass urine, and whether she can pass urine but it is hurting too much, or she's not able, she feels abdominal pain and she's not able to pass even that. Also, we need to ask about any other symptoms like any pain from down below, tingling, burning sensation, any swelling in the groin area, like we asked about, inflamed lymph node in the inguinal region. Also for the general manifestation, fever, anorexia, headache, and malaise, which can come more severe in primary infection. Okay. The second question should be whether this is the first time to have this infection or no. Usually, if it is a primary infection, it will be more severe than the recurrent infection. Okay. Then we will take the full history. We need to stress on the gynecological history. When was her last menstrual period? We need to exclude pregnancy in this situation. And if she is pregnant, we will discuss it further in infection with pregnancy, but we will assume this patient is a gynecologic patient without pregnancy. Second thing, we need to ask about types of contraception she's using. Usually, if she's not using a condom, we have to advise her for using it as a barrier method, because it will reduce the risk of transmission and reinfection again. Okay. We need to ask her about her partner. Is she's having a regular partner or no? And if her partner is having this, like a similar lesion in his private area or no. Okay. And also we need to ask about her like this patient, actually she's 22 years, so she didn't have any smears done before, but if she's older than 25 years we should ask about her smear history. We need to ask also about any other sexually transmitted infections before, if she experienced any of them or no. Okay. um, Also, we can ask about her obstetric history, like, other types of history. In her history, we need to ask about the allergies because we are going to provide her with medicine. So we need to know about her allergies. Okay. So after taking the full history as we used to take, then we need to examine the patient. Okay. So we'll ask her nicely. We just need to have a look on the lesion. We will not touch the lesion unless you permit, because these patients are so difficult. They even can't wear anything on top of their lesion. They will just stay bared, and uh, because of the severe pain, they can't touch the area even with their clothes. So we need to reassure her that we are not going to touch. We just need to have a look, just to be sure about the diagnosis. Okay. Sometimes if she allows, we can take swabs, okay, to exclude other sexually transmitted infection. If she's not allowing touch at this situation, we need to ask her to come in a follow-up visit, like once this lesion is like, resolved. We need to take full screening for other sexually transmitted infection as well. uh, we need to investigate and confirm diagnosis if you can't see clearly, um, like, the lesion, or uh, you can't be confirming whether this herpes or no. So you can take some swabs from the lesion itself. Okay. And we send it for PCR to see, like, we do virus culture. We see like which virus is growing, if is it a herpes or no. But anyway, we will not wait for the culture result. We will provide her with a cyclovir from the first presentation, because it's like, a spot diagnosis. But anyway, if you need to confirm, you can take the swabs. Also, we can do the serology test, like we check for her the IgM and IgG to see whether this is a primary infection or a secondary infection. Um, we need also to ask about any symptoms suggestive of meningitis, because sometimes this virus may invade her CNS and cause um, severe meningitis, severe viral meningitis. So we need to exclude that. So we ask about any neck stiffness, any throbbing headache or intractable headache, any photophobia, any vomiting associated with that, or any symptoms of nervous system affection, like, she will feel any neurologic pain in any limbs or weakness or anything like that. Okay. Then we will reassure her that this infection is usually self-limited, like, it will go by its own, but we need to reduce the complication and viremia. So we'll provide you with a treatment, antiviral medication called acyclovir, um, either to take it as 200 milligrams 5 times a day for 5 days, or 400 milligrams TDS for 5 days. Okay. Actually, if the patient is HIV positive, we need to confirm whether she has any other infection or no, because if she's HIV positive and got genital herpes infection, um, that infection we consider as a severe infection, because her immunity system is not working well. So in that case, we will increase the dose or double the dose to be 400 milligrams 5 times a day for 10 days, and we need to refer her for gum clinic. Okay. That's if she's HIV positive. Then in terms of her main presentation today, she came with a urine retention. So, as our protocol said that if you have a urine retention and your blood risk came more than 400 cc of urine, then we need to put in and out catheter to drain this amount of urine, and we need to keep her in for at least 6 hours, and then to be sure that she can pass urine easily after that. But if after 6 hours she's not able still to pass urine, we need to insert a Foley catheter, okay? And once she's able and she's not feeling pain, we will remove the catheter. Usually, sometimes we may need to keep the catheter for a week time, okay? Um, because the patient in pain, we need to give her intense pain relief by oral medication, and also sometimes we may offer her lidocaine cream or lidocaine spray if she is not able to touch the area. We can also offer her lidocaine spray 10%. Okay. We need to give her some instructions about this infection. She has to know that this infection can be transmitted through direct contact. We need to tell her that she can pass the virus to her partner, so she has to avoid having sex at all during the until this lesion disappear completely. Okay, and to keep the area completely clean using only plain water, just to prevent secondary infection. And also she can apply ice back, should be wrapped in a flannel, that's to soothe the pain, but she can't apply the ice directly on the lesion. Okay. If she's going to apply any local cream, like lidocaine cream, by her fingers, she should wash her hands like strongly before she touches the lesion, just to reduce the risk of infection. And also after painting this cream, she has to wash her hands, because if she touches the lesion and touch any other areas in her body, she can transmit this infection to other areas. Okay. Also, one of the question, if we are taking the history, we can ensure that she doesn't have any of this of the same lesion in anywhere else in her body, especially around the nipple, around the mouth. If she experience any of this lesion at any part. Okay. Um, so she has to know well that there is a very high risk of recurrence. Okay. And but we need to reassure her that the recurrent episode will be much lesser in the severity than the first time, but she still can pass the virus during these recurrent episodes. So once she starts to have burning, itching, swelling in the groin or vesicles anytime, she has to stop having sex, and she has to use the condom. And we can advise her also to use the condom all the time. If she's developing sexually transmitted infection, it is safe to use the barrier method all the time. Okay. If she asked you what can she avoids, like what are the triggers that can give her the recurrence risk or increase her recurrence risk. So mainly if she's in a stressful situation, she can develop this herpes. Like if she's exposed to any situation which make her immune system low, like if she's under effect of broad spectrum antibiotics for a long time, or if she has any other type of infection which reduces the immunity, or if she's like having surgery in the genital area, like if a patient like undergo episiotomy and this area of incision is a very high risk for herpes to come on top later on. also it comes during the menstruation as well. Okay. um, why she has the risk of recurrence? Because once she got this virus as a primary infection, the virus will be kept as a dormant virus in her body, and it will be reactivated with these triggers. Okay. So one of the common questions, if she's planning to have a baby soon, will this affect her pregnancy? Like, she's now not pregnant, but she's planning to have a baby. We need to reassure her that since she's not pregnant at the moment, we expect her to have a healthy baby without any complication, and it will not affect her pregnancy at all unless she gets any recurrent episode during her pregnancy. So if she developed any recurrent episode during her pregnancy, she has to receive the antiviral treatment. um, and in her delivery, the risk of transmission to the baby will be very minimal, is from 0 to 4%. So that's, we call the secondary infection. She will be offered a vaginal birth as usual, and unless she got a very severe infection, in that situation she may need to be admitted to the hospital. Okay. She may also be offered oral acyclovir from 36 weeks till delivery, if she got it, like, in the third trimester, as a secondary or severe infection after that. But we need to reassure her that we will be very worried about you if you got the primary infection in pregnancy. However, if you got it like before pregnancy, we don't expect any complication. Okay. Um, so if you are going to leave the catheter for her, usually if this is a presentation, we need to keep her in the hospital at least for the next 6 hours, just to be sure that she doesn't have any further retention of urine. If she passed urine by her own, that's fine. Sometimes if you give her strong painkiller and this spray and the antiviral therapy started soon, she may go to the toilet by her own after draining this amount of urine. But some of the patient will still being afraid of passing urine, this may extend to the next day even. So in this situation, we will not let her go home unless she feels relief of these symptoms, at least for after 24 hours. And she can go home with the Foley catheter if required, and we need to give her one appointment in the retention clinic to try without catheter after 7 days. Okay. Thank you.